In this video, I am going to talk about what it's like to be 1 year post-op after having a vaginoplasty. So I had a vagina with canal, bottom surgery done 1 year ago. And if that's something you're thinking about getting, if that's something you're curious about, or you just want to know more, you want to be a good ally, and even if you're a TERF and you're going to leave a shitty comment, stick around. Let's get at it. Hi, my name is Kate Madden, and I live on the unceded territory of the Coast Salish people that we call Vancouver, British Columbia. I make videos for trans people in their 30s, 40s, and 50s, and really just trying to help build capacity and confidence in our greater community. If this is your first time here, or you've watched a couple videos and you haven't had a chance yet, if you've enjoyed it, please just like the video, subscribe, maybe share. It would mean a lot. I have done 4 other videos on kind of my surgical journey, and to be clear, to be super clear, surgery is not required to be trans at all. It's part of my journey, it was part of my trans story. It doesn't necessarily mean it's part of yours. And so I've done these videos just kind of to document everything, A, and B, to just show people who are going to Montreal GRS what the process is like. So, for me, it took about 4.5 years from the time I got in line to the time when I had surgery. I recently shared my 5-year update for HRT, and, just in terms of getting into line and kind of when I started HRT, it was roughly the same time, so late 2017. There are so many hoops. Being trans, we learn to check all the boxes. We learn to double check the paperwork. We learn who's a good doctor, who's not a good doctor. And I've been very fortunate. I have great MDs that I work with. And it's interesting, I've never actually worked with an endocrinologist. I've worked with cardiologists, I've worked with nurse practitioners, psychiatrists, surgeons, of course. But in terms of supervising my HRT, it's always been an MD. And both of them, both informed consent, both of them have said the same thing to me, is I don't know what I'm doing and we're going to figure this out together. And what's great is in both those circumstances, in Calgary and then my doctor here in Vancouver, is they're really open to suggestions, to, if I read something online, they'll check it out, and, we'll make decisions together. And that's something I really, really value. Through this process of, jumping through the hoops, checking the boxes, getting all the paperwork submitted, lots of paperwork. Oh my God, a lot of paperwork. You're constantly reconfirming that, yes, I want this. You're constantly double checking. Is this something that I want to pursue? And there's so many opportunities to exit, even up until the moment you're walking into the OR. It's like, are you sure you want to do this? And they're always nobody's forcing anybody to trans. Nobody's forcing anybody to go through this. And, really, you're sticking your hand up at a certain point to be like, oh my God, help me. Somebody, please help me. Because that's really what untreated dysphoria does at the end of the day. It gets to that point. And while I was very conscious that there's lots of opportunities to exit, I knew at a certain point that I did want bottom surgery. And yes, to start, I just wanted to get in line. I wasn't 100% sure. And it wasn't that I wasn't sure I was trans, or, I began presenting female very soon after coming out at work and everything. I knew that there's no question there. I just wasn't sure, from a technology perspective, medically, where was the procedure, was the process, was it good enough? Would it stand up? Would there be horrible complications? And I had seen one too many bad results, which really informed my fears more than anything. And so at the end of the day, I was like, I'll get in line. And so I got in line. You got to go to see psychiatrists, other psychiatrists. And during this process in Alberta, I relocated to BC. So, I went from Calgary to Vancouver, and just in time for COVID. So, not only did I relocate and change provinces, and, if you're in America watching this, it's a big deal because the province is the one that manages the health delivery for all the Canadians. Like, yes, federally, there's supposedly universal health access, and what that means is that we're all supposed to have the same level of access to healthcare, but constitutionally it's the provinces that manage that. So I had to go to the back of the line just in time for COVID, so that delayed everything as well. And I can say, well, it was hard to watch people, who had started after me or had started around the same time as me, see them get bottom surgery or head off to Montreal. And I celebrated them. I was happy for them. I was also super jealous. But then at the same point, when it came to be my turn, and here I am a year later, I just kind of look back at those feelings. It wasn't resentment, but it was unnecessary, and like I got where I was supposed to be. And ultimately, kind of the decision for me, like why did I want bottom surgery at the end of the day, was like as time went on, my bottom dysphoria got worse. It got more intense. It became distracting, and dysphoria manifests itself in different ways, whether that be socially, physically, psychologically, and it just got harder and harder to kind of process through. As well, physically, the results of HRT after a couple of years was that it became painful to have an erection. Like there was a lot of atrophy as well, so it was shrinking, but also it was impacting my self-confidence, my quality of life. Like I was constantly worried, like, is my tuck gonna pop out? Is someone gonna be able to see it if I wear this outfit versus that outfit? What if there's an issue in a washroom and I'm exposed? It was scary. It was really, really scary sometimes. It was just anxiety. That's all it was. Anxiety. And so, yeah, a year ago, I went to Montreal, spent 9 days, Montreal GRS, had my surgery, and I've detailed kind of the early recovery. There were early challenges in that recovery. And I think the key thing I learned looking back is that you just got to slow down. Like you want to do it all. You got to do it all. But you got to focus on healing. And, that means dilation 4 times a day. It means preparing, recovery, drying, bathing. And, that's 6 hours, 8 hours of work. Just right there. The first month is just that. And then you get to drop it down to 3 times a day. And you can run errands now. This is really cool. But you can't do more than like one thing a day. You want to go to the post office. You want to go to the grocery store. You want to go to Canadian Tire, and you're only doing one of those because you got to get back to the bed to dilate. Also, you're dealing with fatigue. It's exhausting. Oh my God, you're just exhausted, and sometimes you're just gonna fall over. Like you're just gonna go to bed and you're done. Those are really the early challenges. Is just learning not to be a hero and to slow down. What's interesting is, I posted a 6-month update a while ago, the last couple of videos I've done. And to be clear, yes, I used clickbait. I was taking advantage of what the TERFs were doing and Matt Walsh and all that. But people messaged me, several people messaged me asking if I was detransitioning. And I think of gender as a spectrum and gender as an exploration, and we're all celebrating our own individual journeys. We should create room and space in our community for people who do detransition. We should be compassionate, empathetic for those people. I have no time for the people who try to harm the community after they leave. But I'm so happy having gotten bottom surgery. It's one of the best things I've ever done. But it kind of leads me to wonder, when you look at why somebody detransitions, it almost always comes down to a lack of support, financial support, friend support, family support, work support, all of it. Something drives that. And I know in my own experience, when I first relocated to Vancouver and was unemployed, I had some dark moments where I was like, should I just put a suit and tie on? Maybe it'd be easier if I just did that. And I'm so grateful. I think maybe that's one of the ways that One of the reasons why I am happy is I'm grateful for the support I've received from family, from friends, from, I had a live-in partner when the first few months. It did make it easier. I'm also very privileged. I had income protection, I had job protection, and I was even able to switch jobs while I was off work. I got headhunted just before I went off, and I just said yes. And I had 12 weeks off from my employer, and then I went back to the new job 7 weeks in because I just couldn't say no. It was a great opportunity, and I was healing really well. So, things got better. Like, they did get better. It is hard at first, but over time, I'd say where I really noticed it was middle of summer. So Pride here in Vancouver is August long weekend, end of July, first week of August. And I was able to go downtown, go to the parade, go to the bars. It was stinking hot, 32, 33 degrees, right by the ocean. It was a great time, but I was able to last the whole day. And, that was a real key moment. And then a few weeks later, I rejoined my soccer team. And so I was able to run around, in the fall, 6 months in, 7 months in. I felt like it had always been that way. Like I had no issues running, twisting, turning, jumping, kicking, passing, sliding, all the things you do in a soccer field. It was great. I think another thing was that anxiety eased, right? Like I wasn't worried about being exposed. I wasn't worried about someone saying something to me. And that made it a lot easier. My healing hasn't been without complications, very, very minor. I had, an issue with antibiotics the first couple of weeks. My skin got blotchy and I reacted. Some odd bleeding early on, but there's never been any discharge. I've complained about a smell in earlier videos. That's completely disappeared as well. The only thing that continues is nerve pain. And last week I had right down one of the incisions, I could feel it. And normally with nerve pain, it's like it hurts for a sec and then it's gone. But this one lasted. And I was in a meeting, I was, in a suit, skirt, blazer, at a boardroom table, and it was so distracting. It hurts, it's painful, but it's not, you're not crying or anything. It's just someone's twisting your skin, and it's healing. It's the nerve endings reattaching, but it still sucks. I think there's some scar tissue that hasn't quite healed correctly, in that I can feel, a little bit of tension here and there sometimes, depending on how I move. I'm not sure. I should probably go see an OBGYN about that. But yeah, everything checks out. It's just there's no issues. I've been, I think, lucky. And, I think it's just that easy recovery has just helped me adapt so much easier to everything in my life being normal. I feel great. I mean, normal meant a UTI a few months ago, but that's just the way things are, You're a vagina haver and you're gonna get that. I've complained in my previous videos about bathing and how much I hated having to do that several times a day. I haven't had a bath in 6 months. Maybe I will get back into that. I don't know. I probably should, just to treat myself, self-care, self-maintenance, whatever. But I think the biggest challenge for all of us right now, early 2023, is the increasing rise of transphobia in the US, in the UK, and coming here to Canada. It's really scary. And I think the most important thing we can do is build community, communicate with each other, keep in touch, build capacity, know who your people are, and reach out. And I think we can only get through it together, as terrifying as it is. I'm really, overall, really happy with how my self-confidence has improved and increased, how my quality of life is better. Like, I carry myself, I think, just a little bit differently, and just that little bit is just enough to feel good. It feels great. It's better than good. I'm single, and I'm happy to stay single. I'm a single parent. And that's been one of the big changes in my life over the last year, is my son moved in with me about 6 months ago. I've had my kids, for weeks at a time now, and that's been really great. That's where my focus is, with my kids and on my job. Maybe you can hear my son. So my focus is there, but I am looking forward to the future. I know someone will come along at some point, but I'm in no rush. But yeah, so I couldn't tell you about sex. I got nothing to report. But it does work. I've talked about that. It does work. I've talked before about, not dating, and my focus is really just my family. Work, that's it. Sure, I haven't had a chance to try everything out, but that's okay. It works. I've commented on that before. And that was a fear. I'd read online about people losing the capacity to orgasm or struggling with that. But I had no issues there. But my son moved in with me 6 months ago, and that really has just been my focus, is my family, my kids, my job, and I just don't have room or energy for anything else. I'm hopeful. I'm looking forward to the future, whatever that be. But not right now. So overall, I'm very happy. 10 out of 10 would recommend. It's really been one of the best decisions I've ever made. Like, it took a while to get there. I had to do a bunch of things, but here I am a year later, and it's been great. It's been really great. Just my overall quality of life, and that gained self-confidence, and everything is just better. Everything's better, except the picture frame. It's been a year. It's been a ride. It's been a wild ride, but it's been great. Not really, I think, a lot to update since in the 6 months, but there you have it. That's the 1 year update. Maybe I'll do a 2 year. I don't know what's there to update after 2 years, but I'm sure I'll find something. If you made it this far, thanks. Not a lot of people do. So please subscribe, leave a comment. If you've gone through this and I missed something, leave a comment below what you think I should consider, and we could discuss. Or maybe others will comment back and forth, because that's really cool when I see that happening. If there's other things, if there's something I missed that you want to know about specifically, ask those questions. And as always, here's to life.